Welcome to The Explainer. I'm so thrilled to have you here today because we're digging into a topic that pretty much everyone deals with at some point, but very few people actually understand. If you have back pain on the lower right side, well, it's probably more serious than you think. Honestly, I want you to think of this pain kind of like a giant iceberg. That muscle ache you're feeling, that's just the tiny tip peeking out of the water. But what's lurking beneath the surface can actually be vastly more complex. It's the classic question we always ask ourselves, isn't it? You wake up, there's this annoying ache or stiffness in your lower back, and your brain immediately goes, did I sleep weird? Or maybe you just assume you sprained something lifting heavy bucks or twisting awkwardly. And hey, I want to validate that for a second. According to the National Institute of Neurological Disorders and Stroke, sprains, which are overstretched ligaments, and strains, torn tendons or muscles, absolutely are the leading causes of acute back pain. But what happens when the rest, the ice packs, and the ibuprofen just aren't cutting it? As we're going to see today, that pain might actually be echoing from somewhere much, much deeper. Okay, let's dive into this. We typically assume we're just dealing with sprains and strains, right? You know, the standard muscular stuff that makes it hard to stand up straight. But the reality? It might actually involve your kidneys, your appendix, or even your reproductive organs. When conditions affect these internal systems, they actually refer the pain directly to your lower right back. So the core premise we really need to establish right up front is this. Severe, persistent, or worsening lower right back pain is rarely just a muscle issue. Section 1. More than a pulled muscle. A perfect example of a deeper structural issue is spinal stenosis. Basically, this is a narrowing or compression of your spinal canal, which is the protective area inside the spine that houses your spinal cord. Now, while this can happen anywhere, it most commonly hits the lower back. When this narrowing places pressure on the spinal cord, it essentially pinches those nerves. And that doesn't just cause localized pain. No, it causes numbness and pain that radiates, shooting right down from your lower back directly into your buttocks and your legs. Section 2. When organs attack your back. Okay, so your kidneys sit toward the back of your abdomen, which makes them prime suspects here. You've got to pay super close attention to secondary symptoms. If your back pain is suddenly paired with cloudy or bloody urine, a foul smell, chills, a fever, or nausea and vomiting, you might be dealing with a full-blown kidney crisis. This could be a kidney stone, those rock-hard mineral deposits causing blockages that trigger sharp, one-sided pain. Or it could be a kidney infection from bacteria moving upstream. Either way, these systemic symptoms paired with right-sided back pain mean you need a doctor immediately, because untreated infections, they can lead to really severe complications like sepsis. Now, what's really interesting about this slide is how your digestive tract actually physically connects to your back. Take ulcerative colitis, or UC. It's a chronic condition that causes inflammation in the lining of your colon. But studies show that UC, along with other inflammatory bowel diseases, are associated with something called sacroiliitis, which is basically inflammation down in the pelvis. So chronic colon inflammation translates directly into lower back pain. If you're getting back pain alongside unexplained weight loss, extreme fatigue, or losing your appetite because of nausea, your intestines might actually be the real culprit. And then we have the appendix. Appendicitis is an inflammation of this tiny organ, usually because of a blockage or an infection. Now, the classic progression is pain that starts right around your belly button and then migrates down and to the right. But what a lot of people completely miss is that this intense pain can radiate straight through to the right side of your back, and it usually brings bloating, loss of appetite, and a fever along with it. Let me be absolutely clear about this. Appendicitis requires immediate medical care. We're talking a straight to the ER situation that usually requires surgical removal. No waiting around. Section 3. Female-specific hidden causes. Because a lot of reproductive conditions have overlapping symptoms, let's break down 3 major culprits. First up, endometriosis, where tissue that acts like the uterine lining grows outside the uterus. This causes chronic lower back pain, especially during bowel movements or intercourse. Second, uterine fibroids. These are non-cancerous growths right in the uterine wall that can press on nerves, triggering back and leg pain, plus unusually long periods. And third, PID, or pelvic inflammatory disease. This is usually a bacterial infection spreading to the uterus or ovaries, and it presents with back pain, unusual discharge, and a fever. And this brilliantly illustrates how seeing these compared side by side really helps differentiate those tricky, overlapping pelvic and back pain symptoms. We also absolutely have to talk about ovarian tumors, which can be cancerous or non-cancerous. The warning signs here are so crucial to memorize because, honestly, they often seem completely unrelated to your back. Persistent back pain paired with getting full really quickly when eating, a frequent urge to pee, or just random GI issues like gas and bloating, those should never be ignored. If you start experiencing any of these and they suddenly become more severe or frequent, you definitely need a thorough medical check. But it's not always an illness, right? Even natural biological processes can refer intense pressure straight to your lower right back. Dysmenorrhea, which is severe period cramping, can radiate deep into the lower back and shoot all the way down the legs. Similarly, pelvic pain during pregnancy is incredibly common. It can hit one or both sides of the lower back, often affecting the perineum, and it noticeably gets worse when you're walking, standing up, or even just rolling over in bed.
Section 4. Male-specific hidden causes.
So we need to talk about testicular torsion. This happens when the testicle actually rotates inside the scrotum, and when it rotates, it physically twists the spermatic cord, which instantly reduces or just completely blocks the blood flow to the testicle. The mechanics of this are exactly as painful as they sound. It causes severe, sudden pain in the testicular groin, but, and this is key, that pain very frequently radiates straight up into the right or left side of the back, usually along with nausea and lower abdominal pain. To quote the medical experts directly on this can cause irreversible damage. Testicular torsion is a medical emergency, period. This is absolutely not a let's wait and see if it feels better tomorrow kind of situation. Anyone experiencing these symptoms has to seek immediate medical attention. It requires rapid surgical intervention to either untwist that cord and get the blood flowing again, or if you wait too long, they may have to remove the testicle entirely.
Section 5. When to call a doctor.
So the crucial point is knowing your red flags. You literally need to memorize this checklist. Head to the ER or call a doctor right away if your lower right back pain comes with any of the following. Number 1, a fever, nausea, or vomiting. Number 2, painful, cloudy, bloody, or foul-smelling urine. Number 3, stools that contain blood or pus. And number 4, severe groin pain. If your back pain doesn't get better with rest, if it's messing with your daily life, or if it's paired with any of these systemic symptoms, that is your body sounding a massive alarm. I want to leave you with this somewhat provocative thought. Is your back trying to tell you a secret your organs are hiding? Think back to that iceberg we talked about at the very beginning. A simple strain from lifting a box, that's just the tip. But your kidneys, your appendix, your colon, and your reproductive systems, they all share neural pathways that can broadcast distress signals straight to your lower back. By understanding these connections, you are empowered to actually listen to what your body is trying to say. Thank you so much for joining me for this explainer. Stay curious, stay healthy, and definitely start listening to the secrets your back is trying to tell you.